we are looking forward to have some new regional representatives, and we are working with colleagues in Canada, in the US, in Central America to have regional representatives. We also are working with people in North Africa and also in basically West Asia, in Iraq, in Syria. Hopefully we'll get them involved as well and form the entire map of the regional concept. For the next part, we are going to introduce the new societies that are being affiliated to ISAM and give them an opportunity to introduce their society and what they are doing and the collaborations that they are making. But before getting to that, I will also kind of going to stop sharing the screen for another moment and again ask people to turn on their videos. And I can see many faces. I can see Ikro right now from Italy, and Ikro is with us today. I can see Carmen, all those colleagues that we have from, I can see Garrett and others who are from different parts of the world, Edyta, all those kind of those people who are collaborating and forming collaboration within the ISAM community. That is amazing to have colleagues and friends who have not have been working with us. I can see Kelly Clark here, all those close friends who have been kind of working together. So that's an amazing community that we have. Please use the chat space and kind of post things that we have and how we might be able to kind of share ideas and discussions together. So that is a great opportunity. We already have over 100 participants in the meeting right now. So let's get back to the presentations, and we will start with our colleagues from Nigeria. It seems Bawo was not able to make it, but his colleague is going to present. And Nikuruawan, you are going to represent Bawo, please.
Thank you very much, Ahmed, and good morning, afternoon, and evening to colleagues all over the world. My name is Ebiti. I'm the president of the Nigerian Society of Addiction Medicine. Specifically in terms of our priorities, we've been able to get ourselves affiliated with ISAM, which is one of the things we really wanted to do. And we've spent the last couple of months and possibly a year driving for membership. And incidentally, we are about 200 members strong. And we are hoping that many more people will come in because we have a lot of addiction experts within Nigeria. One of the things that we are hoping to do is to be able to mentor similar societies within the West African region, especially colleagues in Benin Republic, Ghana, and all that. Because even though substance use issues is the top in Nigeria, as far as West Africa is concerned, we believe that working with our colleagues within the region would make for a better impact. We're also thinking of credentialing in addiction, specifically what would be most suitable for Nigeria, because there is a lot of credentialing that many of them are getting, but they are not being used for anything. So we want to see what would be a lot more recognized within our sphere. So we're working on that. And we're also supporting policy and academic efforts within the region in addiction. For example, we've been able to push for needle and syringe program in Nigeria. And one of us have just concluded a feasibility study for medication-assisted treatment within Nigeria. And that is going to be piloted in a couple of months. And also, the issues of advocacy and promoting best practices within the region. It's such a large place. And we're hoping to make that one of our priorities to see how we can get the Federal Ministry of Health, specifically the Drug Demand Reduction Unit, to actually uptake some of the evidence-based practices that we are hoping will be implemented within Nigeria. And then in terms of cooperation, we are really working with the UNODC. A lot of our programs have been sponsored by the UNODC. Presently now, we are working on the alternative to incarceration, in which UNODC is sponsoring, and Nigerian Society of Addiction Medicine is providing some level of input to that. We also are working with the Community Intervention Network on Drugs, which is the CIND. It's a body of civil society organizations in the country. And of course, we've also been doing a couple of things with ISOP and ICU-DDR. In terms of at the national level, we are actually engaging with the National Agency for Drug Law Enforcement. They are actually the ones that have to do with supply reduction within the country, the NDLEA. And there's a lot that is going on. And their activity actually impact on ours within drug demand reduction. So we're working really with them. And then the national body that is in charge of harm reduction is NACA, which is the National Agency for the Control of AIDS. So we are working with them. In fact, the feasibility study that was done for the implementation of MAT is actually sponsored by that particular organization, which the Nigerian Society of Addiction Medicine is working with. Then in terms of our challenges, it's the brain drain issue is huge. I give you a typical example. Almost every 2 weeks, I am writing recommendation letter for one addiction expert or the other that is leaving the country. People are really leaving the country in droves, and that's a really critical issue for us. And we're just wondering how we're going to cope going forward with the population of, projected population of 250 million people, and then people are just living in droves. So that's a problem. A bill has just been passed in the National Assembly, and they're hoping for concurrence to stop doctors from leaving the country. And we don't know how possible that would be. And that's just to tell you the impact of that particular activity. And then we also have the issue of funding. Most of our programs are actually out of pocket. That's a huge issue for us. So that's a challenge that we are still grappling how best we are going to deal with and overcome if we are going to make impact. But Nigeria is really huge, and we want to make impact in the entire region. We need some level of funding. So that's actually a challenge to us. And then in terms of our future plans, we've talked about the issue of having similar societies within West Africa, in Benin, in Liberia, Ghana, the countries surrounding us. So we're hoping to share our experiences with them. We have different platforms that we are going to share these experiences and possibly even our resources in order to be able to set up this so that it will make it a lot easier for us. We are hoping to have a national conference, within Nigeria on addiction. And we really want to pattern it towards what we see in South Africa, because we really love their drug policy week. It's always very rich. And so we're looking forward to having something like that in the country. That's part of our plan. And we are hoping to expand the membership. Initially, the membership was made up of specifically psychiatrists and doctors, but now we're having a lot more people, psychologists, occupational therapists, social workers that, that are all making up membership of ISAM in Nigeria. Okay. So
thank you very much.
We more or less, okay, thank you.
Thank you very much. It was really kind of impressive in terms of things that are happening in Nigeria. And I'm sure that colleagues in Nigeria would be able to have a leadership, not only kind of organizing things that are happening in their own country, but also supporting countries around them. And that would be an opportunity for collaboration between people in Nigeria and also South Africa and that part of the world, being able to kind of develop some coalitions of collaborations around the mutual interest that we have. So hopefully that will be something that we'll support and push forward. The next new society, please.
Ahmed, can I say one thing? In a way, I think to remind everyone, we're here really to collaborate, to work with other agencies or other organizations. So as a reminder, we already have a memorandum of understanding with ISSUP, with ICUDDR, with UNODC, with EMCDDA, the World Psychiatric Association. So that memorandum of understanding is we aim to work together. So there's no question. This is not about ISSUP and ISAM. It's how can we add value and create a critical mass to make a difference.
Absolutely. Thank you, Alex. The next two speakers, Marie and Gaelle from France, who are representing Fédératif Institute of Behavioral Addictions. Marie, are you with us?
Hello, thank you. We are really happy to be here with you. It's an honor to candidate for joining ISAM. I am Marie Graal-Bronek. I am a psychiatrist and addictologist in France in the University Hospital of Nantes. And I am here with Gaelle, who is a coordinator of the research program in our hospital. We do not represent a federation or association in France, but an hospital department. Our priorities here are to improve the state of knowledge in the field of behavioral addiction and to train health and social professionals in order to improve the prevention and treatment of behavioral addictions and to disseminate knowledge on behavioral addiction to the general public in order to help people with addictive problems as well as their close relatives. Our need are to keeping abreast of innovation in addiction treatment, to initiate international collaboration with common events or research programs, and to participate in disseminating recommendations of good practices in the field of addiction medicines. Now we are able to assess and to treat people with behavioral addiction. We are conducting scientific projects that are unfold around three major axes: assessment, treatment, and prevention. And we already propose training for health professionals and students on information for the general public. In our team, we have medical doctors and psychologists on a research staff with coordinators, that is Gaelle, and research assistants and PhD students. We are already partner of network in the field of gambling disorder, eating disorders, and also the comorbidity of addictive disorders and ADHD. And at the international level, we are member of the International Society of the Study of Behavioral Addiction, and we are candidate to join the international collaboration on ADHD and substance abuse. What we want is to apply international guidelines for the treatment of addiction in our hospital and to facilitate the generalization in other treatment centers in France. And what is expected from ISAM, that is to update clinical guidelines. We are also interested in joining international research program and to be connected with other international researchers, particularly interested in behavioral addiction. And we could plan to organize a workshop on ADHD and behavioral addiction. And ISAM could perhaps provide technical support for the organization and dissemination of the information. I think it is the end. Thank you.
Thank you very much. Thank you very much. And the next speaker is going to be Solja from Finland, Turku. So, Solja, are you with us?
Yes, I'm here. Hi. The photo here is from our president, Jonna Levola. She was not able to make it because she's traveling with her family during Easter. So that's not me. That's Jonna up in the cold. Next, please. Okay, so the Finnish Society of Addiction Medicine. We have been a member of ISAM before. We had our emeritus professor Hannu Alho as the president of ISAM back some more than 10 years ago. So, and somehow on the way we lost this connection, but now we are sort of reunited again. We are 40 plus years old society. And today we have about 350 members, and we are actually a multidisciplinary society. Most of our members are medical doctors, few medical students, but also nurses working in the field of addictions. We accept for members also other individuals who work further for the society's aims, for instance, social workers and so on. But the core function and also all the board members, they have to be medical doctors or nurses. Majority of are actually medical doctors. And this is the structure of our society. So we have this board with president and from 5 to 7 full members, and then deputy members. We have a special competency board. We don't have a specialized training program in universities for addiction medicine. So our society is organizing a 2-year training for addiction medicine doctors, and this is one of the major aims in our society to enhance and provide education for doctors who are working in the field of addictions. Then we have the Board of Education, which organizes national level education events. Specialty is the 2-day event, annual event, and also now we are aiming to broaden our scope for more international and provide also part of our educations in English, and that could be joined also from elsewhere. And then we have very active specialist nurses group who are organized and also on an international level. We also have a work team for those who are doing the specialization in addiction medicine, the special competencies. So we have like a very active group of also young addiction doctors coming up, and which is enlightening that we receive every year more and more doctors who want to take this special competency in addiction medicine. So that's a very good positive news. But however, we are a small society and we are in charge for the training, and we wish that we could have a more like formal level of education for addiction medicine doctors in universities in special. And okay, this is what I already actually mentioned. Nowadays we have 163 doctors with this special competence in addiction medicine. Some of them are already retired because this is one of the oldest special competency training programs in Finland, our addiction medicine system. And yes, we are a key operator, also giving like expert statements to social and health ministry. We have this big renovation in social and healthcare sector ongoing at the moment, and there's a big leap to integrate mental health and substance use treatment services within one organization nationwide. Yes, and now we are back in ISAM, and our president of society, Jonna Levola, is working also as a regional chair in ISAM. Okay, next.
Thank you very much, Solja, for the presentation.
Great.
And thank you for having you here. The reality is, I mean, those societies like Finnish Society for Addiction Medicine, who have lots of experience in the field, they are really instrumental for ISAM to help other societies in other parts of the world who are in the formation phase, to help them, to support the kind of providing them with the experiences that they have and the challenges that they face and the solutions that they have. So we hope that those countries who do not have addiction medicine societies, we will definitely be happy to connect them with the societies that they already have lots of experiences, to see how they might be able to expand the quality of the services that they are providing. So that is the plan that we have. So please do not hesitate to reach out and
yes,
find potentials for those collaborations.
Yes, absolutely. And also we seek for international collaborations with other societies in order to enhance our working, and also seek for more active role within the northern region in Europe to collect our forces to improve addiction medicine. Thank you.
Thank you very much, Solja. Now the next speaker, Cristina Ribeiro from Lisbon. Cristina.
Hello, can you hear me well?
Really well, yes.
Yeah, thank you. Thank you for this opportunity, dear colleagues. I'm Cristina Ribeiro, and I am a medical doctor. I'm actually the president board of the APMA, our association. I work in the Directorate General of Health in the Ministry of Health in Portugal in Quality Department, and I'm a professor at the University of Medicine in Lisbon, and it's an enormous pleasure to be here with you. This is my summary. Please, next slide, if you don't mind. Okay, what happens is this APMA was founded in 1919 in Lisbon by two military medical doctors. This is a brief story, Dr. Margalho Carrillo, Dr. José Carrillo Ribeiro. And now in 2019, before the pandemic, me, myself, and a group of medical doctors tried to reborn APMA and give APMA a new era. Of course, that APMA objectives are to support and achieve high standards in research and learning in the field of addiction medicine, and to promote scientific, technical, cultural, organizational, ethical, and human improvement in addiction medicine. Me, myself, I have a long way near addiction medicine as a medical doctor. I'm the Portuguese coordinator of international projects financed by a European Commission, like FIPA, like ODIN, like BISTERS. And of course, during my work in addiction field, I have the pleasure and the opportunity to be in the Committee of National Alcohol Policy and Action and European Commission. And this is very important for us in Portugal to rebuild APMA again. Next slide, please. A brief history. What is important to see is that APMA has an important and remarkable liaison with ISAM, because APMA is connected with ISAM, with the foundation ISAM, in April 1999. This is very, very important for us. APMA was founded in 1990, but if we can see the co-founders, Emeritus Dr. Margalho Carrillo and Dr. Carrillo Ribeiro, they have an important, they were pioneer in our country, introducing Minnesota model, 12 steps, mutual help groups, and even every prevention programs, including syringe street distribution exchange program, methadone substitution program. And this is important to maintain and to develop in Portugal. Next slide, please. Of course, that they have developed several medical education activities. They have an APMA newsletter. They have national conference twice a year. And in 1995, there are two milestones. One in history of Lisbon, when we have our APMA president and vice president with ISAM and important meeting in Israel, in Portugal. And during this meeting, we have really the opportunity to have the first steps concerning to International Society of Addiction Medicine as an important international society. And of course, next step, please. This is important reference in our work. What we intend to do now in the current situation is mostly training and professional development, identifying treatment modalities and the continuum of care with the chronic diseases, and also developing guidelines, models of care and standards of practice. Me, myself, working in a quality department in the Ministry of Health, we have the opportunity to have this producing of guidelines, relating our work with the community and with the Society of Medicine societies. The challenges is developing at primary health care what is important for prevention concerning substance use disorder and mental health prevention, and looking for effective practices using the best practices in our country, and having the opportunity to disseminate those good practices. Here in Portugal, we are working on integrated model of care, and we intend to put in this agenda of integrated model of care also what is important in substance use disorder and chronic, non-communicable or communicable chronic diseases. Because for the medicine, the colleagues not related with addiction or to mental health care, is it important to see the link between the risk factors concerning substance abuse, alcohol, tobacco, and other illicit substance abuse, and of course the control and the best quality and clinical quality concerning the other chronic diseases, non-communicable or communicable chronic disease. Thank you very much for this opportunity. What do we expect from ISAM? These building connections with other societies. HAPMA is now on the board of the European Federation of Societies of Medicine, EUFAS, but of course it's important to share learning, to work on undergraduate and postgraduate medical curriculum. We have here in Portugal at the University of Medicine the possibility to develop undergraduate and also in postgraduate with a representative of a medicine addiction college in our Ordem dos Médicos. Integrated and centered care concerning chronic diseases is really a pillar for us. Thank you very much for this opportunity.
Thank you very much, Cristina. Thank you very much. And we are really happy to welcome your society to the ISAM global community. The next speaker is going to be Edyta from Ireland. Edyta, are you with us?
Yes, hi. Hello, everyone. My name is Edyta. I am a psychiatrist. I represent Faculty of Addiction Psychiatry of College of Psychiatrists of Ireland. So, and my slide is brief, I suppose, in terms of what our current situation. We're quite involved in different, in development of policies on site in Ireland. Our members are were a national working group to, and developed the dual diagnosis national clinical program, which is now in the process of being implemented. We are involved in the kind of education about impact of psychoactive substances and addictive behaviors and different new, I suppose we are up to date in the new substances and risks associated with it, with using them. Faculty members are also actively involved within health service executive and in development of services and other policies. We are on different, I suppose, faculties in College of Psychiatrists of Ireland, and we are participating in doctors training and psychiatrist training as well. We have about 100 members, I think, but approximately there is maybe 20 regular and active at the moment. In relation to our cooperations, as I mentioned already, we are on the national level. We are kind of cooperating with the health service, with national HRB and national drug-related death index. So we are sort of aware of all the data and we are on the boards there. We are internationally, our members are part of a Society for Studies in Addiction, APA, and hoping to join ISAM. As I said we are not yet fully members, but hopefully that will get processed soon. That's on our side is the slowness. I'm not putting it onto ISAM in any way. In terms of challenges, I suppose they're very similar to what we mentioned already. We are dealing with issues with funding, increasing, I suppose, in terms of public level, increasing access to illicit substances, maybe even legal, making some of them are becoming more legal, and also businesses benefiting from people's addictive behavior. And I think that's what WHO was in your speech as well, Alex, in relation to the fact that those businesses are quite powerful and they have quite strong lobby. So we are kind of involved in talk about, I suppose, making changes maybe in advertising and trying to advocate against those as well. I'm not sure, the next slide. I think it's only one more, so I won't bore you. In terms of future plans, I suppose we are going to be part of the development of services in Ireland and hopefully improving the access to addiction services, and especially integrating variety of resources that are available, because that's been a challenge. We have different, I suppose, NGOs, different, and then psychiatry, HSC. So it would be great to have it more integrated. What is expected from ISAM, I think for us, it will be great opportunity of getting involved with international projects, obtaining qualification in addiction medicine, meeting people with diverse experiences, views, and opinions. But from what I'm hearing also, I'm learning about this, that even from the societies, that it's interesting to see that like our society is purely psychiatrists, and it's interesting to see that number of addiction medicine societies are sort of more diverse in the way they operate. They're more cooperative, it seems. So that's an interesting idea. We haven't thought about that. In relation to our contributions, I suppose we also are bringing our expertise, experiences, views, opinions, and hopefully can be part of the projects and building on body of knowledge. I think that's all from me. Thank you.
Thank you very much, Edyta. Now we go from Ireland to another part of the world, Nepal, to probably Kathmandu. Rabi, are you with us right now?
Yeah. Yes. Hello, everybody. Greetings from Nepal. It's fun to be here. So I'll be talking about our situations. Actually, I represent the Psychiatric Association of Nepal, and let me just inform you that we do not have a separate addiction medicine society. The Psychiatric Association itself is looking after these issues. Actually, we have very few psychiatrists till last decade also, and then so big addiction society. But with the increasing number of psychiatrists at present, and with increasing interest by the youngsters to pick up psychiatry as the profession, so we are finding people who are interested in this field also, but a subsidiary association under this psychiatry itself. So may I have next slide, please? So this is just the outline of what I'm going to present. Next slide, please. Can I? Yeah. So what our current situation, as I said, is that we have priorities to now, and we have a dearth of researchers also. And as I said, that we are trying our best to have a subsidiary organization, means addiction committee under it. We have very few people who are at present who are competent in addiction therapy, but of course the general psychiatrists themselves are also handling the situations. We do have services in most of the medical colleges. There's a separate psychiatry unit, and then they provide service for these addiction problems too. And then the addiction services are mainly provided by so-called rehab centers, which are usually a non-government organization. We have no separate government service center, and then this they are primarily regulated by the Home Ministry rather than the Health Ministry. So we are very unfortunate that this addiction problem is still not under the health services scheme. Can I have the next please? So the main challenge is, as we say, that because this addiction problem is not yet prioritized by the Ministry of Health. So we face challenges like we have the dearth of medications itself, psychotropic, especially the replacement therapies, even the anti-craving agents and things like that. I already mentioned that the rehab centers, they are not regulated by the medical professionals, although there are cursory legislations that it would be monitored. There will be medical personnel, but these are very poorly supervised, and most of the oral replacement therapies and even the decisions are made by NGOs and other medical personnel. And so still, as I said, the addiction subspecialty training is not a priority, and we still do not have that training available in the country. We have future plans. That's why to establish a separate national addiction center. That is one of our dream project, let's say, from our psychiatric association. So we need to, we are planning to make national guidelines and then focus on the long-term rehabilitation of the patients. And at the same time, we want our psychiatrists to take up this addiction psychiatry. So we are encouraging them to take up this. Next one, please. I think that's my last slide. Next one, please. Yeah. So what we can expect from ISAM is that perhaps we can get the technical help as well as the opportunity to build up the capacity, such as maybe if, we can send our psychiatrists to get more training on this, like fellowship programs or things like that. We can be empowered to use modern treatments also. And of course, as I said, that we have a dearth of evidences. Maybe we need more research collaborations also. And with all this, I think we can also contribute to our own social cultural perspective of and our unique problem in our country by doing all this. I think that's my last slide. Thank you very much. It was a great meeting and being with you all and listening to different experiences. Thank you very much. And namaste.
Thank you very much. It was great presentation, and it's just inspiring in terms of the potential for collaboration in the global level and how we might be able to kind of see potentials to interact and solve problems at the global level together. So now we have few minutes to before going to the next part that we are going to discuss about some of the research projects that we are doing together and some examples of the activities that we are doing the global level together. I would like to ask few colleagues that we already have here online with us to put some people on the spotlight and just ask them to introduce themselves and talk a little bit. And Alex, yes.
Hamed, is Mikhail Bish going to present Society?
Mikhail
and Konstantinos?
Yeah, Mikhail, do you want to kind of talk for a few minutes or few words?
Yes,
yeah,
1 minute maybe. Hi everyone, I'm Mikhail Bish from France, and I am the representative from the French Federation of Addictology. The French Federation of Addictology groups together 20 societies, 20 French societies of addiction medicine, addiction psychiatrists, but also association of users, of patients, and harm reduction organizations. We are really glad to get involved in ISAM work, and especially for the development of francophonic events with ISAM. That's all.
Thank you, Michel, and we are looking forward for having more active role from the French Federation and your colleagues on that side. Hopefully, that is going to be a fruitful collaboration in long term. The other person, Alex, do you want to go ahead?
So I'm not sure if we have representatives from Cyprus, Sweden, and of course Rabia mentioned the Turkey Association already, which has recently joined us. But we have Joar from the Swedish Society of Addiction Medicine, Konstantinos from Cyprus. I don't know if they're present or not. No.
No, I cannot hear them. But
for the next General Assembly, then.
Hopefully, that is going to be the plan. Among those who we already have here online. So I was going to ask Tom Clark from NIDA International Program. Tom, do you want to just introduce yourself and say a few words about the NIDA International Program?
Sure. Thanks so much, Hamed. Good morning, or good afternoon, good evening, everyone. My name is Tom Clark, and I am the Deputy Director for the Office of Science, Policy, and Communications at NIDA. And so part of my role is managing NIDA's international portfolio. I do that with my colleague, Lindsay Friend, who was not able to join I do more the policy side. My colleague Lindsay does more on the fellowship side. As you know, SAMHSA and NIDA are very focused on fellows, and we have helped support many Humphrey Fellows, as well as fellows from Invest in DISCA from different parts of the world. So very, very glad to be here. I know Dr. Volkov is very engaged with this group, and I believe will be speaking in November in Marrakesh. So looking forward to that. And very nice to meet all of you, and anything we can do to be of help, please feel free to reach out. Thanks.
Thank you very much, Tom. And NIDA International Program, always has a kind of significant effect on the international activities that people are doing. And I think that you will have your next international forum in parallel to CPDD in June. And hopefully those who are in CPDD will have the opportunity to discuss about some of the international collaborations there as well.
Yeah, thank you very much for mentioning that. So in June 8th and 9th, we will have the International Forum. It will be virtual this year. It's a week before CPDD. We are looking, moving forward, trying to get back to the in-person meetings. Just given where we were in planning last year, and where COVID was in Denver, we weren't able to do the in-person, so we'll be virtual. We have registrations out on our networks, and we'll make sure that this group receives information on that as well. So thanks for mentioning that.
Thank you. I'm not sure if Marika Ferry is with us right now. Marika, are you with us right now? So from EMC. Marika, do you want to say a few words?
Yes, it is quite an exciting moment for our agency, which for those who don't know is the European Union Agency for Drugs and Drug Addiction, because there has been discussion about an extension of our mandate, and this has been approved. So the final text was, I don't tell you, it's a long and democratic process where all the countries and the Council and the European Parliament discuss over the details. So in the next years, we will change our name. It will become the European Union Drugs Agency, EUDA, which is probably easier to pronounce than EMCDDA. And we will have an extended mandate, more space for training, which is something we are very interested in collaborating with ISAM, and other areas like, for example, research, again, very interesting, possible collaboration, etc., etc. So yeah, just this good news and a lot to do. And a big congratulations. I was discussing recently with Alex Baldacchino about the fact that, yes, nowadays a lot of people has access to training. So we have a lot of people very well, how do you say, with very good academic background. But what Alex put together is a bunch of excellent and nice people, which is extremely important, because if you want to be inclusive and open to diversity, you need to be kind, to be welcoming. And specifically Hamed, Alex, and all the others have met through ISAM have this characteristic. So for the future of our agency, because we will also recruit some people, we really would like to learn how to identify and find nice people, the ones that are able to make the difference. Thank you.
Thank you very much, Marika. Thank you very much. It's just great pleasure to work with international organizations, and hopefully there's going to be kind of lots of fruitful activities together.